So if you don't sleep, your body's in fight or flight and it becomes inflamed. And then if you're not getting the proper metabolic health and circadian timing, your body becomes inflamed. So this never-ending cycle. When we manage inflammation, we can resolve chronic disease. This happens when we fix our circadian signaling, maximize your mitochondrial function, which turns off the inflammatory pathway. You start preparing yourself for sleep by anchoring your circadian rhythm. I'm excited, that we're gonna, make this part of Airway Health Solutions, and I really think that this is going to be something that we can build and use as an accent or as an adjunct to everything that we're already offering at Airway Health Solutions.
Welcome, everyone. I am Lauren Gates, your host for Airway Health Solutions Conversations tonight, featuring the dynamic and newly appointed AH faculty member, Dr. Andy Cohen. Welcome, Dr. Cohen. We're so thrilled to have you back. Actually, you're a repeat performance because of all the interest behind our topic, which is metabolic and sleep health. It's basically getting to the root cause to better help our patients. So we're going to really dive in deep as to why this is so near and dear to your heart. It's actually very near and dear to my heart as well, because we want to get to the root cause. We want to get to the final why, right, of why everything is happening. And your own personal story is such a testament to that. And I just love how then you like to take it and pay it forward to help other people help their patients as well. We're also going to highlight how integral the dental and airway professionals are in quarterbacking their patients' metabolic health. Because I think a couple of the questions I received was just, can dentists do this? And are you a dentist or are you a medical doctor? So I'm really excited to dive into that. And before I go with your formal introduction, why don't you just say, hello to everybody and an informal kind of review.
Hi, everyone. It is a pleasure. I'm so excited to see such a great turnout this evening. This is a really special topic for me. It really saved my life and changed my life for the better, finding health. And after 14 years of trying to fix my apnea, and to finally be able to sleep well is a pleasure.
And let's see the new smile. That was with you and Dr.
Yeah,
Mariana
finally
Evans, right?
finished
The
2 years.
combination. So we're thrilled that I just love when people practice what they preach and then just want to take it to the next level to be recruit and basically be an ambassador. So we're thrilled to have you and welcome everyone. We're always so honored that you join us this evening. You take time out of your busy evening to learn more, and that's such a testament to you guys as practitioners. But let's see who's with us tonight. I'd like to take a quick survey and see all the different professions that we have joining us. So we're going to do that survey first. And then I just have a quick survey for you. I'm curious about your dental software, but we're going to start with getting to know you. So let's kick off that survey, please. Let me see if I need to do that. There we go. Okay, so please choose your profession. If it's not listed, we don't activate the chat because sometimes it can be distracting. So you can put that in the Q&A, and we will go ahead and begin. All righty, I don't see the results yet. If Gerald, you could make me a co-host, that would be helpful. Oh, and we're up to 60%. Okay, so we're about 67%. And the dentist may beat out the dental hygienist tonight. Usually the hygienists are in full force. So any patients with us? No patients, no parents. So we're very heavy. We have pediatric dentists, orthodontists, OMTs, SLPs, RDHs, dental assistants. And then if there's another profession, well, we welcome everybody and we're so thrilled that you're with us. I'm going to go ahead and share those results. Yeah, so 36% dentists, 35% dental hygienists. So I think a lot of dentists are super curious about how they can incorporate metabolic health into their practice. And we can also make it a return on your investment as well. So there's ways, I know you'll talk about that a little bit too. The second survey, if you would just be so kind to take a moment, we're just curious to see about your dental software. So we're going to launch that, and we are working on AHS digital solutions for you. So we're just curious to see if we could take a quick poll with the over the 100 people that we have tonight. We'd really appreciate your input on what dental software you use, and we'll launch that. Quickly. As we're launching that, Gerald, are you able to launch that? Oh, here, I see it. Okay. Here we go. So it's 60%. If your dental practice software is not listed, you can please add that in the Q&A section as well. So we'll give it, I don't know if most of the dentists can, if you're a hygienist working in a dental office, that would be helpful. Okay, we're going to end the poll. We thank you for your participation. We really appreciate that. And let's get rolling, because we have a lot to cover. We have a lot of lives to save. But before we do that, I'm just excited to announce that we have a raffle with a special giveaway. And tonight we're going to spin the wheel, raffling off Dr. Cohen's course, The Clinical Photography, the critical skill that drives case acceptance and comprehensive care. I think that this should be like a must-have course. I almost just want to add it to every course that we have, because it's such a game changer. We'll talk about that a little bit too. But the team can take it. We give everyone a year access. I believe it's like an under $300 course, but it's just such a great thing to have to, and we'll explain that a little bit more, but just to show and tell and really just understand what comprehensive care is. To receive your CE certificate, you must be in attendance for the entire program. Zoom software tracks attendance, so we do not need a code or a survey. And here's just a few disclaimers. The views presented are the opinions of our speaker and are not necessarily affiliated with Lauren Gates and Associates and Airway Health Solutions. And the following webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. Always ask the advice of your doctor or other qualified health provider regarding a medical or dental condition. And now it is my distinct pleasure to actually do a formal introduction for Dr. Cohen, and then we'll get rocking and rolling here. So Dr. Andrew Cohen is a restorative dentist in Jenkintown, Pennsylvania, who specializes in dental sleep medicine, educating the profession about the benefits of treatment centered around both metabolic and anatomic options, enhancing outcomes for the sleep disordered patient, and providing solutions that positively impact their lives. Dr. Cohen graduated from Syracuse University in 1994 with a BS in psychology. 4 years later, he received his DMD degree from Temple University School of Dentistry, and he completed his general practice dental residency at Abington Jefferson Health and earned a diploma status in dental sleep medicine from the ACSDD in 2019. And also, what is your new certification that you just got? Because you didn't add that on your bio.
No, I didn't. Yes, so I was just credentialed through the quantum and circadian biology, and I'm actually sitting for the board exam next month.
Okay, well, keep on learning. I love it. As a top dentist in Jenkintown, Dr. Cohen is renowned across the country for his specialty lectures on sleep disorders, case presentation, photography, and comprehensive exams. Also, soft tissue laser. You have an amazing course. We'll talk about that too. And in 2011, Dr. Cohen was appointed visiting faculty at Spear Education and is the moderator of their dental online forum, Spear Talk. Okay, so here we go. Let's get rolling. This is almost like a repeat performance, but I really want to hone in. And we get so many questions on what is metabolic health? Why do we need to know about it? How do we incorporate it? And why and who and all those who, what, why, when, hows. So I thought that would be a great time to just take 20 minutes to review that and then perhaps focus on why the dental professionals and airway professionals can quarterback this.
I'm excited.
I will give you the floor.
All right. So let me share my screen. And let's get started. Okay. Every day, patients walk into my office exhausted, not just tired, but depleted. They've done everything we told them to do: CPAP, oral appliance, ortho, surgeries, nasal strips, mouth tape, and yet they still wake up tired. So we adjust the appliance. We check the airway. We look at anatomy again and again and again. But what if we've been asking the wrong question? What if the airway is not the root problem, but a symptom of something deeper? What if the real issue isn't just how they breathe at night, but how their biology is functioning every second of the day? Metabolic and circadian health is the body's ability to generate energy, regulate inflammation, and coordinate biologic timing in response to environmental signals, primarily light, food, and behavior over a 24-hour cycle. The origin of inflammation comes from the Latin word inflamme, which means to set on fire. How do you make a fire bigger? You add fuel. What is fuel to a fire? Oxygen. When the body is inflamed, oxygen becomes toxic. Excessive oxygen is free radical. Free radicals create oxidative stress, and oxidative stress makes inflammation worse and bodily functions decline. Inflammation can be both a warning sign and a bodily reaction, with the end result leading to chronic disease. We see the warning signs in our office every day. Patients who have high blood pressure, TMJ, anxiety, depression, GERD, autoimmune issues. The list goes on, and healthcare's answer today is medication. But medication only manages the issue. Like CPAP or an oral appliance, you aren't fixing anything. When a patient takes off their CPAP, the reason for their sleep issues remain. And actually, their body has to work harder during the day to compensate and breathe. The same goes for medications we take. Stop taking reflux medication or blood pressure medication. What happens? Heartburn comes back, blood pressure rises. There's another option: address root cause. That is what circadian and metabolic options do. Understand how light signals can help or potentially hurt a patient's ability to heal. Many of you question, how can the sun improve health? Well, we all remember physics and the wavelength of the sun. These signals are absorbed by the body, driving all bodily functions. Infrared and near-infrared light improve mitochondrial function and hence ATP production, which is our energy life source, as well as having massive anti-inflammatory benefits. The visual light spectrum helps regulate and train our circadian clocks. UVA improves nitric oxide release and production of hormones and neurotransmitters, and UVB makes vitamin D and melanin. The full spectrum of the sun promotes healing and provides the foundation to resolve disease. I'm proof of this. In 2012, I was diagnosed with mild sleep apnea. I first made a mandibular advancement appliance, which resolved my issue for a time. As my snoring returned and constant daytime fatigue, I tried mouth tape, nasal dilators, laser therapy over the next 12 years. Each time getting a little bit better for a time and then worse again. It affected my overall health as well. My weight increased, and with each diet, I would drop and then yo-yo back up heavier than I was before. Then I needed blood pressure medication. First one, then a second was added, and almost a third. Finally, in November of 2023, I had custom Marpy, and I opened in 6 days. Immediately, I could breathe amazing. I made a temporary appliance to wear while I was in braces to keep my jaw forward, but wow, I could breathe like all the time. And I thought I was finally on the path to health. What? I was worse. How could that be? In June of 2024, 6 months after Marpy, while at the Breathe Institute, I did 2 sleep studies. I went from mild sleep apnea to severe with an AHI of 37, and I desaturated below 90% for over an hour. Shocked would be an understatement. I called Mike Gunson, an oral maxillofacial surgeon, from class and scheduled for December 11th of that year to have maxillomandibular advancement. I had no choice. I was desaturating into the 80s, but yet not a single person could guarantee me surgery would fix my problem. They all said I would get better, but no one knew how much. That made zero sense to me. If we idealize the anatomy, and this is an anatomic problem, why wouldn't MMA surgery fix me? This gave me pause, and I started looking at other options. I could continue to try and improve my anatomy or take control of my metabolic health. So down the rabbit hole I went. So who is asking why patients don't get better or get better for a period of time and then relapse? What is considered success or a cure when we fix anatomy? Let's look at the data. The three major meta-analyses of existing literature as of today show surgical success of 86%. That's not bad, but a cure of only 38 to 42%. So the gold standard MMA surgery, where we idealize anatomy, cures patients 40% of the time. Well, maybe we need to define what success and cure is and then ask, why is it so low? Success is a 50% reduction in AHI, but below 20. So a person with an AHI of 40 after MMA surgery, if their AHI is now 20, that's considered success. Would any of you look at a person with an AHI of 20 as successfully treated? They still have moderate sleep apnea. A cure is when an AHI is below 6. So only 40% of the time, idealizing anatomy cures a patient. What are we missing? What I found is anatomy is only part of the problem. Foundational health starts with metabolic health. We need to help patients with their metabolic health. Inflammation is the root cause of disease. Improve the inflammatory process, and you can bring about resolution. But that takes dedication. Knowledge is power, so let's help you learn how you can become an advocate to your patients, going from a reactive to a proactive model and improve health at the foundational level. Why is this so critical? And why do I think you should incorporate this into all of your patient care? Because sleep is not just an event that happens at night. Sleep is a result of an entire day of biological signaling, light, timing, metabolism, inflammation. These are the forces that determine whether your patient heals or continues to break down. Sleep is a time for the body to repair and recover. And if your patient has anatomic and metabolic factors affecting sleep, that function is limited or doesn't occur, and the body continues to break down. You can open an airway, but if the patient is inflamed, if their mitochondria are dysfunctional, if their circadian rhythm is broken, they will never truly heal. Because we've been practicing sleep medicine in isolation, instead of understanding that sleep is the output of metabolic and circadian health. The body already knows how to heal. It just needs the right signals. Those signals don't start in the airway. They start with how we live, how we eat, how we see light, how we interact with the environment. If we want to truly treat sleep disorders, we must just stop managing anatomy, and start restoring biology. To do this, you must become educated in circadian and metabolic health. For me, I had to choose between surgery or taking this leap of faith. The result, I now have no apnea. I'm on no blood pressure medications, no reflux medications, and I lost 40 pounds. How, you may ask? By resolving inflammation and improving systemic energy. This was done through improving the light signals my body was getting, blocking isolated blue light and non-native EMF, and reducing sugar. No diet, no medications, no surgeries, just foundational and preventive health. Two aspects of healthcare that aren't very stressed. As a matter of fact, when my primary care physician asked how I did it, he laughed at me, literally laughed in my face, and said, "Seriously?" And I asked him, "How much do you know about circadian and metabolic health?" And he said, "Obviously, not enough." Why doesn't he know? Because healthcare providers are reimbursed for procedures, not preventive care. Our system in healthcare today incentivizes physicians better when our patients get sicker. So if our patients get better, but then start to fail again, what did we miss? Are we asking the right questions? Is it okay for some educators to teach? Well, they got a little bit better. Did they? Who is keeping track of the patients that fail? I know I have had patients who've had surgical correction to eventually start snoring or have apnea again. When we fix anatomy and makes things wider, what stops the soft tissue from growing into that new space? And if that tissue fills up the space we created, but we haven't addressed foundational health, that patient will get inflamed again. When the warning signs of inflammation get worse, it leads to cancer, Alzheimer's, strokes, heart attacks. That is when the system can't keep up. The energy system has failed and your quality of life deteriorates. We have another option. Your patients have another option, combining both metabolic and anatomic treatments. Learning how you can become an advocate for your patients when their primary team is not really doing it. It's no different than when we thought or pediatricians weren't asking their patients how their kids sleep. Or if a pediatrician did ask, they didn't even know where to send them. This message is finally starting to be addressed as we beat the drum of early intervention. Imagine the impact if we all beat the drum to fix foundational health earlier. Our current system of using CPAP, oral appliance, expansion, surgery, it helps a lot of people for a time. Yet who is asking why their tongue or their jaws or their soft palate were a problem in the first place? Why is the tongue restricted? Why are the jaws deficient in the AP, the transverse, and the vertical dimension? Again, why, when we idealize anatomy, do our patients continue to suffer? It's because this model is incomplete. And what do we say when you fix anatomy and your patient is still tired or apneic like I was? Do more surgery and hope it works. An outcome of 40% is great in baseball. You're a Hall of Famer. But in healthcare, that is an unacceptable risk. How can we improve these odds? By improving metabolic health, reducing inflammation, and optimizing systemic energy. Because anatomy is just part of the problem. It's not root cause, just part of the puzzle. We have to become educated and look at light, the etiology of inflammation, environmental factors, circadian health, and metabolic function. Anatomy is influenced by physiology. Light drives every function in our body, and the isolated blue light of our offices, homes, electrical devices, it destroys that. You must learn how and why this occurs. Along my journey, I went from being an appliance dentist to an anatomy dentist to now suggesting there are multiple options for patients. I believe we owe it to our patients to discuss metabolic ways that they can help themselves. A poor redox system leads to more ROS. This means the dominant energy pathway is inflammatory. Systems won't work as efficiently, and the body will slowly get sicker as it tries to accommodate and adapt. We need to understand this and help patients, especially when we are trying to improve sleep. This is not just an anatomic problem, it's metabolic and environmental as well. The traditional anatomic model attempts to correct jaw position, nasal resistance, and structural collapse with the goal of improving snoring, AHI, and oxygen desaturation. Is this enough? Should we, as airway dentists, offer more options? I completely believe the answer to this is yes. For the past year and a half, I have now incorporated a metabolic and circadian model which improves patients' light environment, circadian signaling, mitochondrial function, reducing inflammation to improve redox. Redox is the movement of electrons in the system. Bodily function is fundamentally based on the flow of electrons. When redox potential is low, which means less electronic flow, we have disease. Improving redox leads to airway stability, improved muscle tone, better neurologic control of breathing, deeper sleep, and ultimately healing and recovery. Patients should be informed that the best outcomes come from combining both models because you can't only fix a structural problem without fixing the system that controls it. We are not failing because we don't care. We are failing because we've been trained to look in the wrong place. I had to face this reality. If I didn't improve, I was going down the path of continued disease. What no one knows is what that disease is and how it will affect the quality of our lives and that of our loved ones. You can have 1,000 problems in your life until you have a health problem. Then you only have one problem. When metabolic and circadian health is impaired, energy production drops, inflammation rises, nervous system regulation declines, airway stability decreases, sleep becomes fragmented and non-restorative. How I used to practice sleep medicine, anatomy is the problem, fix the anatomy, fix the patient, has become antiquated for me. I now understand there's many etiologic factors and you can enter the paradigm at any point. It's our duty to inform patients they have options, both anatomic and metabolic, and the combination of the two will have a better outcome. I wish I would have known about taking control of my metabolic health before I did MARPE. Would it have corrected my problem? Well, I'll never know now, but I believe in my heart I had this procedure done so my eyes could be opened and I could share my story with all of you to learn. We need to show patients they have options. The challenge, most patients want a quick fix. We need to keep asking questions and demanding more from healthcare outside of medications or surgical procedures, which both have side effects and can both have unwanted outcomes. The integration of circadian rhythm, which is how the brain and body keep time, metabolism, which is how the cells produce and use energy, and the environment, which are the signals that program both, determine sleep quality, hormonal balance, inflammation levels, airway stability, and recovery capacity. In my practice, I created a 3-month concierge package so I can work with patients via Zoom, helping, educating, and creating a plan of action for them to reclaim their health with the goal of improved sleep and better quality of life. This is something you can all learn and do and create a new revenue stream in your practice. When we manage inflammation, we can resolve chronic disease. This happens when we fix our circadian signaling, maximize your mitochondrial function, which turns off the inflammatory pathway. Our anatomic corrections can be more lasting and more effective. The result for me and the patients I've worked with is better airway stability and sleep quality. But to do this, you must first educate yourself before you can educate your patients about the inputs of light, water, and magnetism. If the body can't produce energy and keep time, it can't produce quality sleep. There you go.
Hey, that's a mic drop right there. Okay. So wow, this is, it's really amazing how just when you think you have, something figured out, there's another, I don't want to say rabbit hole because that sounds so daunting, but there's another tunnel with light at the end to
Yeah.
explore, and just because you walk this walk and you look so much better than the first picture you gave me, your headshot, we have to even like update that because I'm like,
It's funny. I just, so I just finished, as you said, smile,
yeah,
like a week and a half ago, my veneers, because, I'm bijaw deficient. So I really needed, from a dental aesthetic standpoint, I needed jaw surgery because my maxilla is so set back. And so, Mariana Evans was my orthodontist, and she couldn't close the spaces all the way. It was just impossible because I had too much fremitus. My teeth were like banging into each other. So we had to do veneers. And that was really hard for me to have to get veneers done because I never had a dental restoration in my life. And we just finished, and she sent me um, my before and after headshot. And it was like, I'm a quarter of a person. I mean,
right, right.
it's amazing. And it's I feel good. And I just did a podcast with a physician like a week ago, and he says, "Well, what's your energy level like now?" And I I have energy. I'm not tired anymore. It's so nice to feel good and be more present in life, and I'm sharper. I can think better now. It's great.
It's like reverse aging in a way, right? I've,
Well, I mean, you talk to a lot of people who
Mhm.
preach circadian and metabolic health, and that's actually what you're doing. Aging is an energy and inflammatory process. So if you can slow it down and maximize your energy, there's a reason why, you get those 100-year-old people who are, you know,
Yeah,
I mean, it's
absolutely. I believe it.
amazing.
Can you just put your contact slide back up? I know, thank you, Effie, for letting us know. That just went by a little fast, so we can just have that up a little bit longer. That's cool. So there's some very interesting questions about the metabolic health that I'll start with, and then I'll go up into our chat. There's some that are kind of off of that topic. But this is a great question. Which comes first, better sleep or better metabolism?
That's a great question. And how the best way I answer that is it ultimately becomes a vicious cycle. So if you don't sleep, your body's in fight or flight and it becomes inflamed. And then if you're not getting the proper metabolic health and circadian timing, your body becomes inflamed. So this never-ending cycle. So a lot of times when patients come into my office, the metabolic and circadian changes take a little bit of time. So I want to act quickly to get them sleeping better, which is why I'll do laser treatment or I'll make an appliance or I get them in with my myofunctional therapist and nasal breathing. We talk about orthodontic options. So I want to get them sleeping better. But for me, when I started my journey down circadian health, my severe sleep apnea went from severe back to mild in 4 weeks just by improving my sugars, um, seeing the sun, and getting my vitamin D levels up.
Can you give the pointers on the 3 to 5 most important sleep habits?
All right, it's hard
Oh,
to not see you, so I'm going to close.
okay, no, that's okay.
Yeah, I can.
Actually, you're not sharing. I got so interested in your answer that you're
Oh, no,
not
I
sharing
stopped
your
sharing.
screen.
At least I think I
Okay,
did.
I don't think it's shared. So your contact slide, we can just bring that back up. I apologize.
Okay, let me
Thank
see
you.
if I'll bring it back up. Hold
Okay,
on.
we'll get it.
Wait a second. Here. So you want that, right? Okay, now I can see you. There we go.
Yes. So there
Um,
we go. So everyone take a moment, take a picture. Um,
yeah, so repeat the question one more time.
So what we did what comes first, and can you give pointers on the 3 to 5 most important sleep habits?
Okay, number one, without a doubt, would be as Soon as the sun goes down, start blocking blue light. So the critical aspect of that, and when I'm talking blue light, it's your literally lights in the room, electronics, your phone. So I put on, I have amber and red blue light glasses. My amber ones are right here, which I use when I'm on the computer. I just didn't want them to be a distraction during this
Yeah. Right.
presentation. But and then at night, and then when I go upstairs, which is typically around 8 o'clock because I do work early, I wear my red ones. When you buy blue light blocking glasses, you got to make sure that they're doing what they say they're going to do. Most of them are not blocking the proper wavelength of the blue light today. So the benefit of blocking blue light, it starts melatonin production. It is a signal to your brain to release melatonin from the pineal gland that becomes it goes into your bloodstream and it helps you sleep. That's number one. A lot of studies about sleeping in complete darkness. That is a second one. They actually did a study showing that even the lights coming off street lights into your window increases the risk of breast cancer in women. So my patients who are really struggling with a lot of inflammation, I really make sure that their room is as dark as possible. And then the last thing, and this is the tough one, non-native EMF. Um, that non-native EMF, which is Wi-Fi, Bluetooth, that keeps calcium channels open. And when you calcium floods your mitochondria, it causes something called peroxynitrites, which breaks down your metabolic system. So for instance, I make sure my phone is away from me. I put it on airplane mode at night times. I know there's one of my she's such a good friend. She's been sick for a long time and she lives by a military base, and her house is like 6 times the safe dose. So there are products you can buy that can help protect basically your bedroom to cut down on that electronic frequency that interferes with um, our body system as much. So those are like the three tips that I get for like actually nighttime. But the blue light blocking glasses is where I start every patient, and you can get a really good pair of blue light blocking glasses for like $80. I mean, but you got to make sure that it's one of the more reputable companies, and they do come in readers, they come in prescriptions. So I have 5 pairs floating around. I have one in my office, I have some here, I have them upstairs. My wife wears them, my kids wear them, so they all agree.
Let's I think we could take the screen off because I like to see you not in a
Yeah,
little box too when we're
there
talking.
you go.
It makes there we go. Okay,
You
now we're
got
back.
it.
So that was okay, so that's number three. So number four. Are there two more that you want to add to that list, or you just think it's the top three?
Is there?
Yeah.
Oh, I'm sorry. I thought,
Okay.
is there more? Yeah. The if you go to the 10,000 foot view, you start preparing yourself for sleep by anchoring your circadian rhythm. And the way we anchor our circadian rhythm is we see sunrise. And the light that goes in your eye goes to the suprachiasmatic nucleus. It tells your body, stop producing melatonin, start producing cortisol, let's go. And it resets all of your clocks in your body and tells them when they are supposed to do the function that they are supposed to do. So when you anchor that and you get the proper signals, your body it knows what to do when you adapt. And that will help you at nighttime and you'll sleep better. So the light signals, I think, are critical to getting your system. And there's a lot to unpack here, right? I mean, this can go in so many different directions, but ultimately it's getting your body and recognizing infrared and near infrared light, the benefits you get from that. 1 hour later, the benefits you get from UVA rise, which one of them and the critical step to metabolic health is becoming leptin sensitive. That is the reason why people yo-yo in weight is because they're leptin resistant and their body thinks that they need to hibernate instead that it's not safe to access your fat cells so you can use that as energy. And so light signals is, I mean, that's the whole ball game. And you know what? And I can tell a story about that real quick.
Yeah, please.
I was doing really well. So I started my journey in August of 2024. And up until October, I was doing fantastic. And then in October, out of nowhere, I started snoring really bad again. And I didn't understand it. And then it hit me. Daylight savings. I
Mm,
lost the light. My nighttime started earlier. I wasn't seeing the sunrise. And that was my wake up call. This was not about diet. This was not about weight. This is about making sure you're getting all the proper signals of the sun. And once I committed to light, which I mean, you can see how tan I am, and we haven't had that many warm days yet.
yeah.
Once I committed to the light, that is when everything just took off. And I mean, I could eat whatever I wanted, and I was losing weight, which was awesome.
Wow. A couple of people want to know about reputable brands for the blue light glasses. How do you know which blue light glasses are good?
Yeah. So, can I say them?
Yeah, sure.
Okay, sure.
Absolutely.
So I like using blue light blocking. It's called Block Blue Light, and I am affiliated with that company. There's also Lucia Eyes. There's Midwest. I think there's RA Optics, which is really good. Any of those are really, really reputable. I would say that the best thing for if someone is interested in finding out which ones, just message me and I'll email you a list. The ones that I recommend with my patients and the ones that I have are from Block Blue Light.
And how do you spell that? So
Just Block Blue Light, Block and
with
Blue Light, all one
B-L-O-C-K,
word.
B-L-O-C-K.
BLOCK, Blue Light.
Okay,
Yeah.
great.
I
Thank
can, you
you.
know what? I can pop a link in real fast into
Yeah,
the
that
chat
would be great. That
if
would
you
be
want.
great. How long does it take for the metabolism to right itself once you get better sleep? Like how fast did you see the result?
For people who go all in, it takes 8 to 12 weeks. How do I write something in here? Here we go. Paste. All right,
Just
that's
make
my
sure it's to
affiliate code. So
everyone.
if you
Okay,
click
great.
that, if anybody takes that link and you click that, that gives you the best discount that they offer.
Okay, so
And
that is you just have to do it to everyone. You just did it to me, and I
oh, I
don't think
did
I
it to
can
you.
copy the
All right,
link.
let's
Yeah.
try this again.
Just do it, just switch it to everyone, and then we're good to go.
It will not let me do everyone.
Okay. So we
Hold
have the
on.
link. So our team, can you put the link and share that to
Yeah, it's
everyone,
not.
please?
There you go. Okay. So if you
You got
click
it.
on
Okay.
that, the ones I recommend patients use during the day are called screen time or day max. The screen time, they're clear, and that's great for reducing eye strain. The day max will block blue light. And then I use at nighttime, I use, I don't want this. I don't even remember what they're called now. So nighttime, I'm using the nightfall or the sundown. That's what
Thank
I'm
you.
that's what I'm using.
What metabolic marker is the most important to discuss with our patients?
Vitamin D.
Okay. Can you
So
tell us
I
a little
am
bit about
using,
that? Mhm.
yeah, sure. So vitamin D for me is a sun marker. So my feeling is supplementation does not help us. Vitamin D supplementation does not help. There are a lot of articles have been coming out that it's just not very effective, and it's a completely different pathway. And also, when you take a bolus of vitamin D, the half-life is very short and very fast. When you get vitamin D from the sun, it becomes bloodstream and it works for a very long time. Uh, my recommended level for anyone with any inflammatory disease, which sleep apnea or a sleep disorder is, they gotta have to have a vitamin D over 60 naturally. So like right now is like prime time where I'm really able to help patients. It's harder, way harder in the winter. And if you have someone that's sick, they have to cold plunge, and it's a tough ask.
Okay,
So
curious about that. There's so much out there with cold plunging. You want to just touch upon that? Is that part of your regimen?
yeah, oh, it is. So the benefits of cold plunging is you act okay. So, when I talk about sunlight, the question I get right away is, well, what about skin cancer? And it's very interesting. If you start asking people where they get their skin cancer, it's never on their face or rarely. Okay. People do get skin cancer on their face. I'm not denying that. If you get the proper signals and build your solar callus, you're not going to burn. And just because you're outside doesn't mean you're in direct sunlight. You can sit under a tree, you can sit under the shade. You're still getting the benefits of being outside because light is quantum. Um, and we have a lot of articles that are coming out. There's the all mortality articles. There's an article that was just released by a dermatologist, which is really exciting. They studied 419,000 people and showed that there was decreased cardiovascular and non-skin cancer for people who had a higher UV exposure and no change in incidence of skin cancer. So my personal belief is I think isolated blue light, because it's causing inflammation. That is what's really behind most chronic disease, which cancer is one of them. So I you know
Okay.
I think when you understand how to do it safely and what the benefits are, and you understand the physics, then you would feel much more comfortable about explaining to people the benefits of being outside. And oh, so why cold plunge? You got me. So our body has, if the sun is bad, why would the body have UV receptors? So all of our hormones absorb in the UV spectrum. That's what makes them go. So what cold plunging does is it actually activates our internal UV and has been shown to make internal UV light. And light is what powers the electron transport chain. That's what makes our energy and our ATP. And I go really deep into that so you can understand that process.
So let's say a patient is interested and wants to do your regime. Can you give a highlight overview of what that looks like?
Yeah, so it's a 3 month process
Mhm.
that I work with them. And I ask for blood work, which I can have them do with their primary care providers. Or if their primary care provider doesn't want to do the blood testing that I want, then I can order it. We as dentists 100% can order blood work when it's related to a problem. So, periodontal disease is an inflammatory issue. If your patient has an inflammatory issue, you can order blood work and look for inflammatory markers. So I want to get an understanding of their baseline. My patients come in, I do a full comprehensive exam on every single one of them. So I'm looking at the anatomic factors. I review both boxes with my patients, the anatomic options and then the metabolic options. If they want to do one or the other, or they do them both at the same time, then I package things together to make it more attractive for them. You can work up 100 different ways to help a patient say yes to treatment. And then typically what I'm doing, every one of them is via Zoom. So it doesn't take up office time. I love doing it because I'm going to see the sunrise every day. I do them Friday, Saturday, and Sunday between 8 and 11 o'clock in the morning. My first Zoom meeting with them is usually the longest, it's about an hour. And then after that, it's checking in with them via cell phone, via email. If they ask me a question that's too hard to explain, then I do another Zoom. So I'll probably Zoom with them 3 times, about once a month. And, then they have the option of continuing, or they are on the right track and I've taught them enough. I use a software called Practice Better, where I made modules that um, literally teach them. It talks about what podcasts that they can listen to so they can get as much as they want to become their own advocate for their health. And I'm doing this not only for my patients, but I'm working with a lot of doctors from across the country who are a little frustrated that they're not, they know something's wrong and the medications aren't getting them where they want to go. And that's why I love walking, a lot of dentists, myofunctional therapists, nutritionists, they call me up and to help them get started for themselves and then also incorporate it in their own practice.
Thank you. Can you
Yes.
speak on the quality of our genetically modified organism foods, organic
Oh,
foods, I don't know, and
yeah.
how it's changing our genetics?
Yeah. So that's Roundup. It's called glyphosate. And yeah, it's really messes up with our metabolic function. And I have switched. We don't eat um, the breads from America anymore. We get them like I get all my pasta from Italy. It's called Dura wheat, so it's not the bleached flour. If you look at the ingredients between what they have in the exact same foods in Europe and what they have here in the States, it's completely different because they've been banned in Europe. Um, it literally causes genetic mutations in us, and it's a problem. It's a problem on an epic scale. And then I think the question really needs to be asked is why would they allow it? And then if you understand who controls healthcare, maybe there's a connection with that. It's very I spent a lot of time being angry when you start to learn about this, you start to see where a lot of problems are, and they seem like such common sense to make ourselves healthier. So we have to learn ourselves and become our own advocate.
Absolutely. There's a couple questions about just the business, the billing, and the marketing, but how
Yeah.
do you bill for this? Is this just fee for service? Are you
Yeah,
able
it's
to?
concierge. There's
Okay,
no way you can do this non-concierge. It's
right.
too much time. There's not enough procedural reimbursement to do that. So initially, you're going to have patients say no, and that's okay. Let them hear about it. It's the same, when we see our patients, how is your sleep? Not everybody wants to say yes, right? Not everybody wants to say yes to ortho or surgery right away. They want options. This is an option. And I tell people, look, we're going to get you started. Let's get you sleeping. Let's get you feeling better. And then if you want to try to um, take care of some other things, maybe not get cancer again, then let's try to fix your health at a foundational level. And that reminds me of a patient of mine who came to me. She just got or beat breast cancer. And I said, "Oh my God." I'm like, I didn't even know. I'm like, I'm so happy you're here. And she's like, "Okay, now I'm ready to get started on my sleep." And I just said to her, just in passing, I'm like, "Well, I'm sure your oncologist told you that you need to block blue light at night, right?" And she started to cry. And I said, "Oh my God, why are you crying? Like, what did I say? I just told you to wear glasses." And she's like, "I begged them to answer why I got cancer in the first place. And how could
Mhm.
I prevent it from coming back? And they didn't have anything for me. They just told me I was good." Well, that's not true. If you don't fix foundational health, we're not good. We're just biding our time until our environment or our health loses energy and then it starts to come through. And she worked with me and oh my God, she did so well for such a long time. It was awesome.
And that's so rewarding. So, what's your advice then for someone who is so interested in this, they want to start this? What would be the next step for someone wanting to get involved in this? Where can they go to learn more about this organically, if you would? I know we've done previous chats on this, but just
Yep.
about what metabolic health is, maybe resources to provide for their patients so they can say, oh, this is a real thing. You know what I'm saying?
Yeah, yeah, yeah. Um, Well, when we roll out our course, that's going to be all
Yes,
the information that they
I
need.
know, I know.
I'm excited, that we're gonna, make this part of Airway Health Solutions, and I really think that this is going to be something um, that we can build and use as an accent or as an adjunct to everything that we're already offering at Airway Health Solutions. So I'm excited about that, and I'm excited to get that rolling out, which I'll let you talk
Yes.
about in a little bit.
Yeah, we're going to talk
You
about
know,
that in
if
a little
if you want to learn, Jack Cruz, he is the godfather of all of this,
bit.
and that is where I learned. He's he I, when I read his blogs, it takes me 2 hours to get through his blogs. They're deep. He's a, he oh oh there you are. Okay, I thought I lost
Yeah,
you.
I'm here. Nope, I'm here.
He was an oral maxillofacial surgeon that became a neurosurgeon,
Mm.
and he has been at the forefront of circadian and metabolic health. And that's where I started, and then I dove down deep.
Okay. Can I just make sure we're seeing the screen that says new patients looking for airway dentists?
Yep,
Okay,
I see
perfect.
it.
So, and it's so interesting because we have this vision of not only airway dentists, but like metabolic health dentists, and you have to start somewhere. So I feel like it is a missing piece of the puzzle. I'm really excited for those solutions. So I just have a visual aid of different colors for those metabolic health dentists as well. So I just wanted to put that out. But if you're interested in getting on our locator and getting started with us, you would have to, the entry point would be taking one of our mini residencies with Dr. Ben Moralia. And then I just want to go over some of the courses that you already have available on demand. And
Sure.
I I am over the moon about this course because the photography, why, first of all, you have beautiful photos that we've seen throughout, just, and you enjoy it. You're going to Africa in June, just on a photography, but you don't have to be a photographer to take good photos, but tell us why they're so important.
You know what? I think the best way for patients really, what I found over the last year and a half, especially, patients want to understand why. And there is no better way for a patient to understand what's going on, whether it's their airway, whether it's comprehensive care, whether it's their TMJ, whether it's orthodontic. When you show them good quality photographs, they are more prone to say yes to treatment. And my camera that I bought in 2010 after I went to facially generated treatment planning with Frank Spear, which was a life-changing course, has treatment plan more dentistry than I ever could have without a camera. It's show them, don't tell them. Is sharing is caring, as you like to say. And I think it is the single best way to communicate not only with patients, but specialists and other colleagues. So to me, it's a can't miss skill.
And don't take this the wrong way, but this is the photo I was referring to, where it's like you just so much more inflamed here. It's a good photo.
Yeah, it is a good photo, but I'm about 30
you
pounds
know,
heavier there.
but it was like, wow, it's like, okay. And I experienced the same thing by just exercising and being in the sun and eating well and doing the things that you mentioned. People are asking me what I'm doing, which another question would be also about your opinion on the GLP-1. You want to just touch on that real quickly because it's such a hot topic?
Yeah. So this is a tough one. So
Okay.
I will never say no that some patients need a boost and some patients will benefit. I do not think it should be a medication for the masses. And the way that it works is it slows down your GI system, which is critical for serotonin production. And ultimately, it affects energy, and your body becomes energy starved, and the next place it will go is muscle. And that is why people are having heart problems and vision problems. They're getting something called Ozempic face, where they're literally eating away at their own muscle because their body is energy deprived. And that is exactly what circadian and metabolic health tries to avoid. If you want to lose weight, fix your leptin and it will come off lightning fast and it won't yo-yo back up.
Agree wholeheartedly. All right, let's talk about your soft tissue laser course, because this is the anatomical component. You're not just saying to do metabolic. It's not, you're not only one lane. This is what I love about you, how comprehensive it is. And Dr. Gulati Rao, she just gave a nice note in the chat. I don't know if you can see it in the Q&A, but it's that you're so inspiring because you're doing a full comprehensive evaluation, including metabolic health. So tell us a little bit about the anatomical
Yeah.
solution as well.
So in my office, what I offer is the lane that I want to be in is I will make an appliance for someone, I will improve nasal breathing, I start myofunctional therapy, um, and I'll do laser procedures to tighten the soft palate, to tighten the floor of the mouth, helping the tongue move away from the back of the throat, to try to reduce tongue volume. I do red light therapy with my patients, both in their mouths, in their nose, in their TMJs. I love doing that. And then when it comes to the structural fixes, I am very fortunate that I have Mariana Evans in my backyard. So that's where my patients are going. They're driving an hour and 15 minutes to go to her because she's the best. And what is the most refreshing thing is that Mariana is so supportive of the metabolic side to this. She is sending me so many patients for me to help the metabolic side. So she gets it, she sees it. And that's what's just so awesome. When you have great minds that are working together, we can just reach so many more people. And the laser it's a tool. And that's what I tell people. If I have a little presentation thing that I got from Aaron M. It's amazing. I wish I had it here to show people. But what it does is it shows the tongue in the back of the airway, and then it has a slide that it shows the soft palate. Well, if somebody's soft palate's blocking their airway, you can move their jaw forward as far as you want. The soft palate's still blocking the airway. So it's a valuable tool, but that's what it is. It's a
Right.
tool. I don't look at it as a standalone, but between that and doing lingual frenectomies and buccal frenectomies, you can help out a lot of people. And those are some procedure things that you can do while you're talking and helping people with their metabolic health.
Wonderful. Thank you so much. And we put the link to this landing page so you can learn more about it. And also, if you're interested in the metabolic dentistry pathway, please enter your information and we'll circle back. We're looking to launch a pathway to do this Q3. So the end of Q3, actually, it's coming up on the beginning of Q3 rather. So we'll keep that posted. We're really excited to add this to the forefront. We decided to break it up into stages because it is rarely new, and rather than dive in all at once, we figured we'd take the journey along with you one step at a time. So we're really excited for that. I do want to share some of our new courses that you may not be familiar with, and I had the pleasure of hosting this with Dr. Umakant Katwa and Dr. Stanley Liu on collaboration. This is another course where I feel like it's an elective, it's a foundational course. But the takeaway from this is it's providing the solutions for collaborating with your pediatricians, your oral surgeons, your ENTs. They're both MDs. Dr. Katwa is actually a pediatric pulmonologist, and he is telling you why it's so important to incorporate airway centric type of glasses, if you would, visions diagnostics at day one, even prenatal. So take it from the experts. They give you roadmaps. They give you clear, active, actionable items that you can take back to your practice and start collaborating. Because wholeheartedly, I believe that if we can reach the pediatricians, then our job's so much easier. So please consider that course. It's actually available on demand now, and highly, highly recommend it. We also have an integration course. This is pediatric with Dr. Jenna Schwibner, and the day 2 starts next week. So if you wanted to jump on the bandwagon to participate live and ask your questions and be part of kind of what we can help you with as far as your barriers, please consider joining. Even though it already launched, you can get the recording and follow up on us for next Friday. So this is something where Dr. Jenna, she took our course back in 2020, and now she has a Foundation First Airway Center that she's launching May. So she took every step to become Airway only, as well as having another general practice. So now she has two practices, one for general dentistry and one for airway dentistry. So she's really inspirational. And then also Dr. Pia Gandhi, she's wonderful. She was just on the, what's that podcast called? Box Sticks, did I get that right? Anyway, she's on a wonderful podcast, raising information and awareness to all, but she will help you integrate pediatric laser dentistry into your practice. This is not a foundational course. We recommend you go to the Breathe Institute or Richard Baxter for that. But this is once you've done that, this is an also good integration course. So we're trying to really pinpoint on these barriers to treatment so our patients can get more access to care. So we have a pathway. I'm happy to go over it with you. I don't want to spend too much time, but you see there's all different levels, all different pathways. That's for the pediatric, this is for the adults. So you can set up a call with me. I'm happy to go over anything. We have wonderful electives to add on for everyone to learn from. And our Myo courses are really, they're amazing as well. In fact, we're going to be launching a new course soon on treatments. So we will keep you posted on that. Please take advantage of our coupon codes that are available through May 31st for joining us this evening. We really do appreciate that. 10% off of selected AHS courses. Those wouldn't be the intro courses. And then $100 off of Dr. Cohen's courses, because we really want your feedback as well. So this is a gift for you for being with us tonight. Airway Palooza is proudly going to be combined with the Breathe and Thrive Symposium in 2027. Here is a sneak preview of our speakers. We haven't announced it yet, but I could hardly keep contained. We're going to do a formal announcement on the annual kickoff. So we're going to have everyone under one roof, and there may be even some more keynote speakers joining us. So we do hope you can join us, because we also are having Myopalooza the day before, and we're having some heavy hitters. Actually, Patrick McEwen is the keynote speaker for that, for the Myopalooza on the Thursday before. And Dr. Cohen will be on the podium as well, enlightening all those with his story. But God knows what you'll be doing by April of 2027, right? It'll be a whole new thing. So anything can happen in the quantum. So we do have an early bird ticket. The prices will go up. So this is a really hefty discount, and we do everything under one roof, and our socials are included. Everything is top notch, but it's a really special conference. And we do hope you will join us, because they have sold out the last 3 years, and being with Breathe and Thrive, it'll definitely sell out. We are always thrilled to offer our free education for you and raising awareness. And I'm so happy to feature Dr. Clete Kushida. He will be with us May 6th, and he'll be talking about the ripple effect of OSA, obstructive sleep apnea, affects far more than sleep. So he's going to give us some nice data and latest research on that. And then May 12th, we're going to have Brittany Murphy on treatment options for the myofunctional therapist. And on May 20th, we're going to do Dr. Sri Koka on mental health. So we think that that's an important topic, because May is Mental Health Awareness Month. So please, if you haven't, spread the word, share with your colleagues. There's plenty to go around. And I also wanted to just always highlight the Children's Airway First Foundation. They have so many great resources for you. Here's some upcoming conferences. I just wanted to make sure everyone knows about this, and we will follow up with this as well. But I don't want to take too much time, but just to make sure that everybody knows of these live conferences. I think it's always great to be live and get together when we can. Here's some coupon codes for the AAPMD. And then we'll also be sponsoring the WDSS in June. And I think that's a wrap. So before we go, let's go to the raffle and see who gets the free clinical photography course. This could change someone's life, right? Maybe they'll be going to Africa in a couple of years. They'll get the bug. So let's see who's our winner tonight. I'm sorry we went over a little bit, but I wanted to make sure that we answered all these pertinent questions. Okay, so Cassandra Cassandra Cust, welcome. We are so excited for you to take advantage of it's not the pediatric health course, it's actually the photography course. So thank you and congratulations. We will be reaching out to you. So let's stop sharing the screen so we can close out strong. Dr. Cohen, I always learn something. I feel like I'm on the right path to this metabolic health. And it's just nice to know that once you know the science, it really isn't that complicated. It gets so overwhelming, but the body's a machine. It's meant to heal. We see that firsthand with perio, right? It can heal
Yeah.
itself. So why don't you close us out with just some, a word of advice and maybe just where the future's going.
Yeah. The word of advice is it took me a while to wrap my head around how light can improve your life so much. And then, and I have to give a special shout out to my best friend, Doug Sanquest, who showed me the way, and he, was there for me and supported me. Um, it's when you see the light at the end of the tunnel and you just want to help people get there, having the ability to offer and be another point of reference for your patients and your family, it's so rewarding. And not everybody wants to hear what you have to say, and that's okay. Um, but we keep pushing, and I see the needle in just the 2 years that I've been involved in this really moving in this direction. And I think this is going to be ultimately the future of healthcare because we can't really get much worse than what we're going right now. So
This is true.
yeah,
And maybe if we keep this up, we'll be hosting this well into our hundreds.
I would.
Right?
Yeah. As long as I can go on a photography trip, I'll do whatever you want.
Exactly. Well, thank you everyone for joining us. We really appreciate this. I know this is a different topic, so thank you for being curious. Thank you for being open-minded. Dr. Cohen, thank you for taking the lead and paying it forward with your experience and wellness. And here's to good health for all. Until next time, thank you everyone. Have a great night.